You are now listening to Extracting Wisdom. Here to help you prevent the decay of your future is your host, Brandon Evert.
Welcome back to another episode of Extracting Wisdom, the podcast designed to help prevent the decay of your future. My name is Brandon Evert, and before we get into today's main topic, I want to tell you all about what I've been up to and why there's been sort of a lack of posting on my end, whether it's on social media or this podcast, which should have been out yesterday. So what happened was about a month or two ago, I was asked by a new DAT company called PAT Booster. This is a new DAT prep company that specifically focuses on raising your PAT score. And I was asked by them to help out with the top front end section of the PAT. And whether you're a pre-dental student or a dental student, we all know and remember that the PAT was unlike any other test that we've taken before. And you all know how much of an advocate I am when it comes to the PAT and just hammering out practice question after practice question. And so PAT Booster can help you do just that. One of the awesome features of this website is that every question has a 3D visualizer, so you can rotate the object with your mouse and actually see what it looks like in 3 dimensions. And this is actually really helpful, especially when you're trying to train your brain to think in 3D based off of a 2D image. And this is actually a crucial skill in dentistry, whether you know it or not, especially when it comes to reading x-rays, because an x-ray is exactly that. It's a 2D image, but we need to be thinking of a 3D object. So anyway, go check out PAT Booster. It's going to help you raise your PAT score without a doubt, and you just might see me in the top front end section as I walk you through each question. The link for PAT Booster will be in the show notes, but if you are listening to a different platform where you can't see the show notes, just go to Bevert.dental and check it out. And with that, let's start the show. Okay, ladies and gentlemen, and future dentists, thanks again for tuning into another episode of Extracting Wisdom. This is episode number 36. So what I want to talk about today is the Sim Clinic. And I'm going to share my tips and tricks and some of the things that I've learned in my personal experience for how to succeed, how to get great looking aesthetic restorations, and how to comfortably work under pressure when it comes to performance exams. And I really hope this is helpful for all you D1 and D2 students out there that are listening. And if you are a pre-dental student, don't turn this episode off. I think it's going to be really helpful for you to understand how to succeed in the Sim Clinic before you actually get into it. All right, so I have my list pulled up here. I have a whole bunch of things that I want to talk about, and I'm just going to go line by line, and we'll go through it. So tip number 1, be confident. Be confident. Before you even walk into the Sim Clinic, you want to make sure that you are feeling confident and optimistic that any work you do that day is going to turn out great. And this really is a simple mindset routine that you should work hard to get into, because if you think about a good result, then more often than not, you're going to get a good result. And unfortunately, though, this goes both ways. If you go into clinic afraid and nervous and you have that mindset where you know that the composite you're going to do is just going to turn out terrible, most likely it will. So mindset is such a big factor when it comes to dentistry, and it can have a major impact on your work. And that goes for both inside of dentistry and outside of dentistry. So be confident going into that Sim Clinic. Tip number 2 is to trace your movements before you start cutting tooth structure. And this is going to be especially important when you are developing your indirect vision skills and using your mirror when you first start drilling maxillary teeth. Now, I can guarantee that at some point when you are looking into that mirror, that you want your hand to move one way, but it moves the other and you totally ruin your prep, or you just completely destroy an adjacent tooth. I've been there, and it's not fun. And This can especially be nerve-wracking when you have to drill in a maxillary tooth under the pressure of a performance exam. So what can we do about this? One way that you can sort of get around this is that before your very first cut into the tooth with your burr, just trace your burr along the path that you want your hand and burr to go. Okay, and this is going to kind of help your brain and your hand get on the same page and make you that much more confident in your movements and that much more confident in doing your work backward in the mirror. Okay, tip number 3 is to use light pressure when you are doing your preparations, whether that's a cavity preparation or a crown preparation. You never want to push super hard with your handpiece. And obviously, if you're a D1 and you're learning, it's going to happen. Okay, you got to kind of push the boundaries and understand how much pressure is too much and too little and all of that. But you really want to keep in mind that using light pressure is an advantage, because even though you might not be able to cut tooth structure as fast as you want to, you're going to be so much more controlled in your movements. And control is crucial, and that's the key to success whenever you're doing anything with a handpiece. So take your time, use light pressure, don't push too hard, and I think you're going to find yourselves having a much better time getting the restorations to look and to feel the way that you want. Okay, tip number 4 is to take your time. I think every single dental student out there is guilty of this in one way or another, especially if it's your summer term and you have sim clinic in the afternoon and it's 85 degrees out and all you want to do is go hit the pool, right? We're all guilty of that. But what I've really found through my own personal experience is when you try to rush things and you try to go too fast before you're ready to work at that pace, you end up making mistakes. Okay, that's a given, right? But in actuality, you're going to spend more time fixing those mistakes as a result of going too fast than you would if you were just to slow down and take each step at a time and do things the right way the first time. Right? That makes sense. So just really focus on doing just that. Take your time, take a breather, and make sure that step 1 is done and completed and done to a high level before you move on to step 2. Because if you were just to rush on to step 2, you're going to create more problems due to, not having a perfect step 1. So I hope that makes some sense. Just slow down, take your time. Okay, another thing. This is tip number 5, I believe. Another thing is typically how our sim clinic sessions will work is that we'll go into sim clinic and we'll perform our procedure, and before we can leave, we have to have a faculty member sign off on whatever it was that we were doing. And so something that I've kind of found myself doing is calling over a faculty member to look at my work, knowing that there's a problem with it. Okay, because again, this is kind of comes with that rushing mentality. I want to finish this as fast as possible. It might not be perfect, but I kind of just want to get that signature and get out of here. But then, of course, the faculty, whoever it is, will catch all these mistakes that you knew about already, and then they're going to make you go back and fix things, and then you're going to be kind of frustrated and upset. So the question is, before you call over your faculty member to check your work, you have to ask yourself, are you happy with it? Okay, and if you're not, either do one of two things. 1, fix it and be able to recognize your mistakes. Or 2, call over a professor, not for the signature, but to get their advice and say, hey, I'm seeing this issue and I'm not 100% sure how to correct it. And this is going to really help you become a more critical self-evaluator. And I know pretty much all dental students across the country, whenever they're in sim clinic, they have to do these self-evaluation sheets of your work. And this is crucial, especially when you're in private practice and you no longer have faculty looking over your shoulder. You want to make sure that you kind of run through all those checklists in your head to make sure that your restoration is going to look good and feel comfortable for your patient and last in your patient for as long as possible. Okay, so just always ask that question before you finish something is, are you happy with it? And if you're not, try to pinpoint the why. Because if you know the why, and sometimes it's hard to know what exactly is off about your restoration, and that's where your faculty come in. But that's the whole reason behind asking yourself and critically self-evaluating yourself, is to pick up on those things and pinpoint where you need to fix things. Okay, and the last thing I want to talk about, tip number 6, is practice outside of class. And I know I've talked about this a lot on this podcast, but it is so crucial. And I know after a long day of 8 to 5 in dental school and sitting through lectures and exams, the last thing you want to do is stay after class for an hour or an hour and a half and do some restorations and practice, right? So, and you can get around this, obviously, if you want to come into class over the weekends, if your school allows that, which in my opinion is even better. And that's typically what I do all the time, is I'll wake up early on the weekend and go in, because then you're in an environment where there's, and this even happens after school as well, you're in an environment where there's no faculty around, there's less students around, and you're going to feel just less pressure. So you really can feel free to try different things, use different instruments, especially when it comes to composite, using different instruments or different techniques, or using different types of composites, or just trying new things that are available to you but you typically don't use in class. That's your time to do that, and that's your time to really develop your hand skills. You really want to make sure, especially as a D1 and D2, before you start seeing patients, that you are an efficient clinician and an efficient student, right? You want to make sure your patients are happy, and you don't want to keep them in the chair for 2 hours to do a class 2 composite, right? I don't think you would want to do that, and your patient certainly doesn't want to be sitting there numbed up for that long. So practice. That's the key. Practice, practice, practice. And the thing is that I found myself progressing more and more when I go in on weekends and practice things, just because of that stress-free environment. Okay, so I think I've hammered this point enough. Practice outside of class. The last thing I want to just mention, this is kind of a bonus tip, if you will, is to watch YouTube videos. There's so many good ones out there, especially for composites or crown preps or whatever. There is one, which I will mention, there's a YouTube channel. What I'm talking about is, I think it's called Stephenson Dental Solutions. I'm just pulling this up on my iPad right now just to double check. Yeah, Stephenson Dental Solutions. This guy has a great channel, and he walks you through all of the basic procedures that you're going to be learning in dental school, and he really walks you through each one and kind of talk about the mindset and just kind of the procedure as a whole. So watch videos, see what other dentists are doing, see what other students are doing, because who knows, they might be using an instrument that you have access to that you've never thought about using before, but it may take your restorations to the next level. Or, unfortunately, you might not have access to those things. So you can either ask a faculty member or, buy it for yourself, or just use another instrument, but try to use it in the same manner that the other instrument was being used. So that's pretty much it when it comes to the sim clinic. You just really got to work hard, and you got to put the time in. But if you're not confident, you're not going to have good results. Okay, so really try to be as confident as you can. And I know this has happened to me, especially quite a few times this summer, when we're learning new procedures every week, and so many things being thrown at you. There's been times where I'm sitting in sim clinic and it's just not my day, right? And it's very easy to then become discouraged and then bring that with you to your next sim clinic session. So just make sure and just keep this in mind, that if you have a bad day, tomorrow's a new day, okay? Come in confident the next day, and I promise you're going to have a better result than you did solely because you were confident and you didn't let yourself kind of fall in that negative spiral. So those are the tips that I had. I just wanted to sit down and talk about this topic because I just finished just a couple hours ago, actually, they call it the gateway exam. So it's a Class 2 composite and a Class 2 preparation on the maxillary. And this is kind of your gateway into seeing patients. This is, if you pass this exam, then that means that you are ready and you have the hand skills to start treating actual patients. And if I did not mention something that you typically do when you practice in your sim clinic, let me know. I really want to know what you're doing. I want to get better as a future dentist, and I'm sure everybody else listening to this wants to do the same. So please share. Send me a message on Instagram or send me an email at Bevert. So that's Bevert.dental@gmail.com. Send me an email, and I'd love to hear from you. One more thing. I keep thinking of things. One thing when you're practicing outside of class, one thing that is a really good idea to do is to purposely put yourself in tough situations, because what can go wrong will go wrong on performance exams. And if you've never put yourself through that scenario or never experienced that failure or whatever's wrong, you want to be able to know how to correct that. And a perfect example of this is a Class 2 composite. So you have you just put your composite against the band, whatever matrix system you're using, and you pull it away and you have no contact, right? That's a pretty common issue. So how are you going to fix that if it's in a real patient, right? You're not just going to throw your hands up and say, oh, well, you can't let that patient walk out the door. And you certainly don't want to leave your performance exam without a contact, because that's, pretty much a guaranteed automatic fail right there. So put yourself through those tough situations and kind of come up with a procedure or a strategy. So as soon as something goes wrong, you know exactly how to fix it and exactly how to come out on top with a beautiful restoration. So hopefully you were able to take something away from this episode. If you enjoyed this podcast, if you enjoyed this episode or any other previous episode that I've done, please leave me a review, either on iTunes or Spotify or whatever else you're listening to this podcast on. I would really appreciate a 5-star review, and let me know how I'm doing. I wouldn't be doing this if it wasn't for you guys and all the awesome comments that I get and all of the discussions that you guys have started between me and other students. It's really awesome to see kind of this knowledge-hungry future generation of dentists. So it's awesome. It really is awesome. So thank you guys for listening, and thanks again for tuning into this podcast. I will see you guys next time. Take care.